Good morning. In previous section, we have seen about discuss about the what is afterload, what is preload, how the heart rate is affecting, and the cardiac contractility. Now we'll see about the what are the different drugs used in the congestive heart failure. So there is the two distinct goals which is used into the drug therapy of the congestive heart failure. What is this two? Relief of the congestive or low output symptom and restoration of the cardiac performance. So this is the restoration of the cardiac performance. What are the drugs? Inotropic drug like digoxin, which is a cardiac glycosides, dopamine, next like diuretics like furosemide, RAS inhibitor like AC inhibitor, vasodilator like hydroxyl nitrate, nitroprusside, beta blocker, metoprolol. Those are the drugs. Arrest or reversal of the disease progression and prolongation of the survival possible with. So this is the to you can say that reversal of the disease progression or stop the disease progression, and this is mainly like AC inhibitor, beta blocker, aldosterone antagonist. So these are the drugs there. So mainly here we are going to discuss about the digoxin. Now, cardiac glycoside, whenever we are talking about the cardiac glycoside, this is a family of compounds that are derived from the digitalis purpura. Now, like digoxin, digitoxin, these are the drugs are there. Now, what is the mechanism of this cardiac glycoside? Now, digoxin has mainly two principal mechanism of action. What are the two mechanisms which is important? One is the positive inotropic. It is considered as a positive inotropic drug. Now what is meant by the positive inotropic drug? They are increasing the contractility, contraction. So that is we are calling as a positive inotropic drug. It increases the force of contraction of the heart, because in the congestive heart failure there is a decrease into the cardiac output. So they will increase the force of contraction by reversibly inhibiting the activity of the myocardial sodium potassium ATPase pump. And SN node inhibition. Now in case of the positive inotropic effect, we are going to discuss in detail. Now AV node inhibition by stimulating the parasympathetic nervous system. It's slow electrical conduction in the AV node, therefore decrease the heart rate. So it is reducing the heart rate. Why? The rise into the calcium level. Yes, so the rise into the calcium level to prolongation of the phase 4. Phase 4 it is prolonging, and the phase 0 of the cardiac action potential plus phase 0 of the action potential, whatever we have discussed, thus increase the refractory period of the AV node. Slower conduction through the AV node carries the decreased ventricular response. That means, what does it mean? It is not like that ventricle it will be quickly it will be going to constrict and less blood it will pump. Adequate time it will be there, ventricle it will pump properly. So this is the two basic mechanism. Now mainly we are going to discuss about the positive inotropic action. Now before we go discuss about the mechanism of action of cardiac glycosides, say what is happening to the cardiac muscle. So this membrane potential generally in the cardiac muscle, it is the minus 90 millivolt plus minus 90 millivolt. Now here there is a sodium potassium pump plus sodium potassium pump. Now this sodium potassium pump, what happens to this sodium potassium pump? So sodium goes out and potassium comes in. Next, where from it is coming? It is coming to the another sodium potassium exchange. Through this it is causing the sodium potassium exchange. Now here the calcium sodium calcium exchange. Sodium and calcium can goes in or comes out. It may be happen. Generally, what will happen? It will goes up. You can say that. This sodium it will come in, and then this calcium it will go out, because if there is a separate voltage voltage sensitive L type of the calcium channel is there, through which calcium is coming in. Now this calcium it is generally stored into the sacroplasmic reticulum. Clear? Sacroplasmic reticulum. So what will happen? So number calcium entry of the outside cell triggered the release of much quantity of the calcium from the sacroplasmic reticulum. So if there is a more calcium, it will potentiate, or it will triggering the SR to release the more calcium. Increase calcium, it will, you can say that it will cause the contraction. Clear? It will cause the contraction. Next, what is calcium is removed by the uptake into the sacroplasmic reticulum and extrusion from the cells by the calcium and sodium exchange. And here sodium balance is restored by the sodium and potassium ATPase. So this is the normal functioning. Now we'll see how the digital is acting. Now here again, so what we are talking, the sodium potassium ATPase, the same thing. Just look in, the potassium is coming in and sodium is going out. Now what will happen, this sodium, yes, this sodium, because this sodium, it will coming in how, coming in through the, this is the sodium calcium exchanger. Through this sodium calcium exchanger, sodium is coming inside and calcium is going outside. Plus calcium is going outside. Here you can find that again, calcium is coming inside to the calcium channel. Clear? Calcium channel. So as I told, this is the L type of the calcium channel. And of course here again the calcium ATPase also it is there, and as we told that the membrane potential is 19 millivolt. This calcium, it will bind to the troponin. Let's bind to the troponin, and we know that it will be responsible for the contraction of the heart muscle. Now what will happen, when the digoxin, we are giving the digoxin, it will bind, and it will bind to what? It will bind to the sodium potassium ATPase. Plus it will bind to the sodium potassium ATPase, and it will inhibit the function of the sodium potassium ATPase. So digoxin, it will bind here and it will block the sodium potassium ATPase. If it is blocked, what will happen? Potassium cannot come inside, sodium is not able to go outside. Plus sodium going outside, it is blocked. If the sodium is not going outside, that means sodium is more quantity. So due to this, it will cause the negative impact. So that sodium is not coming inside. Clear? Sodium is not coming inside because sodium is more in quantity. If the sodium is not coming inside, then what will happen, through this exchanger, calcium is not able to go outside because it is the exchanger, sodium coming, calcium going out. So due to this, calcium, it will not go outside, but here to this calcium it is coming. Now when there will be the more amount of the calcium, it will be, because calcium it is coming, but through this exchanger it will not able to go out, so it is present into the more quantity. Further, it will act on the RYR2 receptor, that is the ryanodine receptor calcium channel. It will act on the ryanodine receptor calcium channel, and it will trigger from the sacroplasmic reticulum. Here again the calcium through the PL, it will act on the sacroplasmic reticulum calcium ATPase2, and it will trigger the more amount of the calcium to release of calcium from sacroplasmic reticulum. Plus sacroplasmic reticulum. So here the calcium is available into the more quantity. If it is available into the more quantity, it will act on the troponin. It will bind to the troponin more, and as a result, contraction it will move. Clear? So by that way, digoxin, it will bind to the sodium potassium ATPase. So sodium, it is not going to able to outside. It will indirectly inhibit the sodium and calcium exchanger. So amount of the calcium, it will be increased into the inside the cell. It will trigger the calcium release from sacroplasmic reticulum. So more calcium now available into the cell, inside the cell, and it will bind to the myocardial cell troponin, and it will cause the contraction. So more amount of the contraction, more amount of the release of the blood. So cardiac output is increases. So this is, we are talking about the normal. See, this is the normal. This is the cardiac output. Let's normal. In case of the untreated, in case of the congestive heart failure, A point, it is dropped to B point. So you can find that how much reduction into the contractility. Clear? Now if we are giving the drug digoxin, if we are giving the drug digoxin, what will happen? From this C point, which is untreated, that means congestive heart failure, the cardiac output, it will increase to D level, but it will not go to near to the normal. We need to understand it will not going to be the normal, but it is the more than the pathogenic condition, that means untreated heart. So you can say that after treating with the digoxin, the cardiac output, it will be increased, fine, but it is not going to the normal. So it is you can say this. So that is you need to understand. So this is about the mechanism of action of digoxin. So hope you have understand. If any doubt, we can discuss.